Good morning. Hello and welcome to our learning session today, Health First, Communicating about Health and Obesity in Scotland. I am Claire Hislop and I am the organisational lead for Diet, Physical Activity and Healthy Weight at Public Health Scotland. And I'm absolutely delighted that we have had the privilege of working with Sophie Gordon from Frameworks UK to develop both this session today and also the communication guidelines that will be published and available to you all from today, and we'll put links to these at the end of the session. So this event marks another step in our journey as we reframe our communications about health and obesity, and we'll be working with many partners in the coming months to continue this. So my job today is just a bit of housekeeping firstly. So this session will be recorded. So with the exception of our presenters, we will have you all muted and your cameras switched off. But you can communicate with us through the Q&A panel, which you'll see at the top of your screen for any technical issues you might experience. But there'll also be an opportunity after Sophie's presentation to ask some questions. So we would ask that you also add these to the Q&A panel, and my colleague Suzanne Connolly, who's been working closely with Sophie on this, will help us to facilitate answering as many of these as we can. So without further ado, I would like to now introduce and thank our keynote speaker, our Chief Exec at Public Health Scotland, Angela Leach. Angela's tireless drive, passion and leadership for improving health and lives of people in Scotland is admirable, and we are really grateful for her support and championing this work for us today, but also for our wider work on improving diet, physical activity and healthy weight. So thank you, Angela, for speaking today, but also for all your support, and I'll now hand over to you.
Thank you, Claire. That's really kind of you. And it is an area that I am particularly interested in, amongst others. But good morning, everyone. I'm absolutely delighted to be here today and to welcome you to today's event, Health First, Communicating about Health and Obesity in Scotland. The event also marks World Obesity Day on the 4th of March, so a couple of days time, with this year's theme calling for a change in perspectives on how we talk about obesity. Its aim is to correct misconceptions and to end stigma. So I think that we can all agree that today's session with Frameworks UK and the launch of our new guide to framing communications about health and obesity is timely. I'm sure it might even have been planned. The guide builds upon Public Health Scotland's work on weight stigma, which brings together recommendations from Frameworks research into health and obesity, the wider determinants of health, and related issues such as poverty. It would be remiss of me if I didn't actually take the opportunity to draw to your attention the work that we've done on challenging weight stigma and the learning hub that we have. So if you haven't had a chance to look at it, it would be worth visiting the Public Health Scotland website and looking for the virtual learning environment. We can provide a link for that in the chat. So the Hub is an evidence-based resource aimed at increasing awareness of weight stigma and the impact that it has on individuals, and it also identifies actions that can be taken to address it, quite importantly in my view. It's been a real collaboration in the making. Our work at the group that have pulled this together have included a range of individuals, academics, and we're particularly grateful to Dr. Stuart Flint, and organisations such as the Mental Health Foundation, the Minority Ethnic Inclusion Service, the Alliance, BEAT UK, Diabetes UK, Obesity UK, Obesity Action Scotland, NES, Food Standards Scotland and the Scottish Government. But most importantly, the content in the Hub has been informed by people with lived experience of higher weight and weight stigma. And they have shared how their lives have been affected by bias and discrimination. I would challenge any of us to spend just a few minutes listening to the lived experience accounts that are documented there, and not to leave feeling that we need to do a huge lot more to address this issue. As Scotland's National Organisation for Public Health, we are ambitious in our vision for a Scotland where everybody thrives, and we're committed to doing things differently to tackle our public health challenges, and that's been the case since we were formed over 3 years ago. We have a unique sponsorship arrangement which is quite different to any other health board in Scotland, and we have that dual accountability to both the Scottish Government and to COSLA being the Convention of Scottish Local Authorities, and it's the umbrella group that represents all 32 local authorities in Scotland. And that dual arrangement reflects the important relationship that we have with both spheres of government, and the role that they then play in protecting and improving population health in Scotland. So the arrangement allows us to work across both the national and the local landscape, and it provides us, importantly, with valuable insights into the varying needs of the communities, the length and breadth of Scotland. Improving population health and reducing obesity has never been more important. We see that in so many of the reports that we in Public Health Scotland produce. Everyone in Scotland should have the opportunity to be healthy and to thrive, no matter where they live, work or learn. And I firmly believe that all our children deserve access to healthy, nutritious food and, importantly, opportunities to play and be active. But sadly, as we all know, this isn't always the case. Our high streets are flooded with unhealthy food. Our supermarket aisles are piled high with buy one, get one free offers. Our bus stops and virtual worlds are replete with adverts for discounts and offers promoting unhealthy foods. I think it's quite overwhelming. We also know that people living in communities most affected by poverty tend to be disproportionately impacted, and we saw that in so many ways during the pandemic. It's been a sobering fact that almost double the number of our children from the most deprived areas in Scotland are at risk of obesity in comparison with those in the least deprived areas. Too often the most affordable options are high in fat, sugar and salt, and healthier options are out of reach. Again, our evidence and the evidence of many others tells us that it's roughly 3 times more expensive to consume a healthy diet. Fast food outlets in Scotland are significantly more prevalent in communities most affected by poverty, and access to healthy food is more limited. Having worked in 4 different local authorities over the course of my career, I can definitely testify to that. Undertaking physical activity can also be much more challenging in these communities due to things like safety, less welcoming spaces to play or be active, and limited access to quality green space. We also know that children living in communities most affected by poverty are more likely to see marketing and advertising of unhealthy foods when compared with their counterparts living in more affluent areas. So these are just some of the reasons for the disparate experiences in health and weight, and we see that across Scotland. I think that we can agree that these go far beyond the notion of individual responsibility. What's really needed is comprehensive action across the system to stem the flood of unhealthy food and to create healthy, equitable, sustainable food environments and spaces and places which encourage more walking, wheeling and cycling for everyone. You probably know that at Public Health Scotland, we're committed to action to improve health, address obesity and diet-related inequalities, and you're going to hear much more about that today. But just let me give you a few examples of some of the work that we're doing that Claire and the team are really pushing ahead with. So we're working with community food initiatives to develop cash-first approaches. We're collaborating with Food Standards Scotland to develop a new Eating Out, Eating Well framework. We're engaging with stakeholders across the industry and local authorities to support businesses to provide healthier foods when people are out and about. We're also supporting evidence around the restrictions of price promotions on food high in fat, salt and sugar. And more recently, we've been taking forward a whole systems approach to physical activity. And again, you'll find much more information about that on our website. These are just a few examples of the work we are supporting across Scotland. And to be honest, it doesn't do justice to the sheer breadth of work going on. And I know that many of you certainly lead. However, in the public and political debate in Scotland about how to improve health and address obesity, the wider determinants are often left out or misunderstood. And in fact, only yesterday I was in a meeting, and it would be indiscreet to say with whom, but I was really quite taken aback just how obvious that focus on individual behaviour was. So some of the dominant ways that people tend to think about obesity leads to a narrow focus on individual level solutions. A focus on individual responsibility also leads to stigma and othering, a sense that this is other people's problem to solve, not something that we all have a stake in. People also tend to see obesity as an unfortunate and almost inevitable part of modern life, and therefore not something that we can solve. So when people, our citizens, the public struggle to see how the wider environment and life circumstances link health and weight, they're less likely to support and demand the policies and actions that are needed to start addressing these issues. So our work collectively is to frame health communications to tell a more powerful story, a new story which avoids triggering unhelpful mindsets and shows how what surrounds us shapes us. And I do think that's worth emphasising, that our communications must demonstrate that it's what surrounds us that shapes us. In telling that story, we can build the support we need for the wider changes that will enable everyone to thrive and be healthy in Scotland. So as I said earlier, you're about to hear about our latest publication with Frameworks UK, Health First, Communicating about Health and Obesity in Scotland. The guide is for everyone communicating about health and obesity, and it provides really practical tips and advice to help build understanding, reduce stigma, and really drive action on improving health. I'm going to hand over to Sophie Gordon now from Frameworks UK for her to tell you more, and I hope that you really find the session, the event, useful this morning. Thank you very much.
Thanks, Angela. Just bear with me 1 second while I bring up my slides. Hey. So, hi everybody, thank you so much for joining today. As Angela said, I'm Sophie, I'm a Senior Communications Strategist at Frameworks UK, and today we're going to be looking at how we can all tell a new story about health and obesity in Scotland, a story that builds public understanding and support for solutions which will ultimately improve the health of the nation. First, a little bit about Frameworks UK for anyone who hasn't met us before. We are a not-for-profit communications research organisation. I know that's a bit of a mouthful. Basically, we work with charities and other mission-driven organisations to help them achieve social change through strategic communications research and support to actually use that research in practice as well. And we know that when we change the story, we can change the world. We are the sister organisation of the Frameworks Institute in the US, which has been conducting framing research for more than 20 years. And Frameworks research shows how people understand social issues. It tells us not just what they think, but why they think it in the first place. And we use this knowledge to develop and to test communications approaches that will help organisations to create the lasting change they want to see. Here are just some of the organisations we've worked with in the UK recently. We focus mostly on issues around children and families, homes, poverty and health, which is of course our focus for today. A couple of other notable examples of our recent projects. We're currently working with Each and Every Child in Scotland to reframe care experience in light of the Independent Care Review and the Promise. And our work with the Health Foundation focuses on communicating about the wider determinants of health. This slide is total overkill and I don't expect anyone to read it, but I've included it because I just want to illustrate that there's a really substantial body of research that we're drawing on today, and then it's all available to you. Much of it is reflected in the comms guide we've created with Public Health Scotland, but also all of our research is freely available on the Frameworks website if you want to really dig into some of the stuff that's behind our recommendations. And while our focus today is on health and obesity, this was also informed by other research into issues such as poverty and the wider determinants of health. So we've been able to take a really holistic view about how we need to tell this new story. Quick look at what we're covering today. We'll start by looking at why framing matters and how it has an impact in all of our work. We'll take a look at how people think about health and obesity before heading into some recommendations to apply to your communications. I won't be taking questions during my slides, but we've got a good amount of time for a Q&A at the end, and Suze will be taking a look in the Q&A panel to pull out some questions that we'll discuss. Before we get into the sort of meat of the session, I want to start with a quick experiment. All that you need to do is pay attention to the next slide and just think about what you see, maybe even jot it down if you've got a notebook beside you. But yeah, not a trick question, just have a look at this next slide and think about what you see. There we go. Okay, so very short little animation there. And just think about what you've seen, and that all will become clear in a moment. This experiment is known in psychology as the Michigan Fish Test. Yes, a great title. And it was presented to American and Japanese participants in a study conducted by Richard Nisbet and Takahiko Masuda. So the experiment basically was that people were shown this 5-second clip, and then they were asked, "What did you see?" And the results of this experiment were that the group of Americans paid much more attention to the fish, essentially the sort of main characters of the scene, while Japanese participants described the scene much more holistically. So they were describing things like the coral, the water. And we regularly repeat this experiment in our workshops at Frameworks and find that people in the UK overwhelmingly fall into the same camp as the Americans in the study. They notice the fish first and foremost, the number of fish, the colours, maybe the fact that one is slightly ahead of the pack. And this is unsurprising, as our culture in the UK is much more similar to the US and to Japan. And why on earth am I talking to you about fish in the first place? It's because this experiment demonstrates a very important point, which is that most of us don't see context first and foremost. And when we're talking about issues like health and obesity, our inability to see that context is a big problem. And it's one that I'm going to keep coming back to throughout this webinar. Let's start by having a look at what framing actually is and why it matters to our work. So framing is the choices that we make about what ideas we share and how we share them. And this includes what we emphasise, how we explain an issue, and what we leave unsaid. And we're all framing all the time. So think about when a friend or a colleague is upset and how you might adjust what you say. You might be more positive, you might offer solutions, you might decide not to say something about something they did that was problematic because now is just not the time. So what you're doing here is you're framing the conversation. And that's the good news. You all actually already know how to do this. The difference between that and what I'm going to be talking to you about today and what's in our comms guide that we've created is this is not just built on instincts. All of these recommendations have been empirically tested to work at scale. And why does this matter? Why does framing matter? It matters because these choices that we make when we communicate can lead to radical changes in how people think, feel and act. I'm going to take you through a few examples of this. So firstly, framing shapes how issues are seen and understood. Let me give you an example of what I mean and the power of framing. So in this classic experiment, the researchers wanted to look at the impact of framing on the choice between different medical treatments. Respondents were asked to choose between surgery and radiotherapy treatment for lung cancer. And some of the respondents in this experiment were patients, some of them were medics, and some of them were students. One group were told there's a 90% chance of survival following surgery. And a second group were told there's a 10% chance of mortality following surgery. So it's the same probability here, but it's just framed in terms of survival or mortality. And these were the results. The survival frame led to a substantially higher preference for surgery compared to the mortality frame. And what's really surprising here is that this framing effect was no less pronounced for the medics, for the people who had a solid understanding of the treatment and the probability already. So regardless of their knowledge and expertise, how people were primed to think changed their understanding. Because our words matter and our frames matter, they really can shape how issues are seen and understood. Another reason why framing matters so much is that it can help us to surface understanding. Now I'm going to show you some footage from our work on child obesity. It's one interview of the same person asked the same question 2 times, and your challenge here is to spot the difference in the before and after clips. And in between these clips, this man was read a short, well-framed story about child obesity, one that was designed to shift the story away from child obesity and the damage done to one of improving child health and our need to act. And I want you to just look out for the difference between these 2 clips.
And how about child obesity? What comes to mind when I say that?
Immediately, I'm thinking that maybe the parents are coping with their children in maybe the wrong way. They're feeding them too much, giving them food to keep them immediately happy, and not considering the longer term benefits of eating healthily.
What would you say needs to happen for child obesity to go down?
Well, as I said, it's eating less and moving more, really. Yeah, I often say to myself, I'm surprised that we are still allowed to advertise certain things on the TV as we do. Perhaps there should be some tighter restrictions on how the advertising takes place these days. It just comes down to the things, the producers of food. If they're making stuff that's going to make us unhealthy, that needs to be addressed. To how the food is marketed, how aggressive that is, and how much it's particularly aimed at kids.
Okay, sorry again about my little hiccup there. Hopefully that wasn't too distracting and you could all see the difference between that before and the after clip. But to summarise, he basically goes from a default of individual blame and the need to simply change people's behaviour as our solution to instead looking at systems and the role of advertisements and food producers in particular. Now, this shift from the individual to their context is exactly the change in understanding that we need to make when it comes to the issue of health and obesity. And there's one more thing that he says that's really important here that got our researchers really excited when they got this footage back. In his after clip is when he says, it all comes down to, and I often say to myself, when he'd actually said something very different moments before. Now, these are really strong indicators that he did think these things already. He had this other understanding about systems and about context, but they were just not top of mind. They were not immediate and obvious until he was given the right frame, which triggered that more productive thinking. So framing can help to shift understanding, but also surface understanding, which just isn't so top of mind. And a third reason why framing is so important is that it can actually lead to real, tangible, important change. I expect you'll recognise some or all of these campaigns. They're all big social movements from the last few years. And all of them used framing to mobilise people and to make change around a very particular story. They help to drive people's attention to systems and to context, and they help to reduce stigma in many cases as well. And all of them communicated in ways that showed why their causes mattered and what they were truly about. So let me just talk you through these. Top left, I'm sure you'll recognise this as being some examples of people protesting for equal marriage. So this narrative around the need for equal marriage moved from a story about rights to being about love and family, something which everybody could actually associate with more and was actually more tangible than the idea of rights. And that's where we really saw this sort of shift to people coming on board and supporting it. Secondly, looking a little bit further back to when the smoking ban was brought in. So this could have been just all about individual blame and the evils of smoking, but actually the narrative which really saw a significant shift and lead to policy change was the need for a healthy working environment that benefits many without secondhand smoke. Bottom left, the narrative around using PrEP to prevent HIV is worlds apart from the 1980s public health campaign Don't Die of Ignorance. So the current narrative around PrEP is all about prevention, it's about empowerment, and it's about removing stigma instead of that previous approach of just instilling fear. And bottom right, this is a little snapshot of a campaign called Keep the Lifeline. This is one that we worked on as part of talking about poverty with the Joseph Rowntree Foundation, and it was a coalition of lots of people working in the anti-poverty space. And this campaign was all about framing the uplift in universal credit as something that was essential, so a lifeline, not a handout. All of these campaigns succeeded in changing the story, shifting it, and changing how people think at scale. They made their story the story. But it doesn't just have to be big campaigns like these. The choices that we make in our communications every day all play a part in shifting people's perceptions of vital issues and creating space for positive changes in our systems and our society. So this could be in the reports that you write, the content that you share on social media and on your website, and even just the conversations that you have each day, both at work and in your personal life. Often messaging on an issue can look a bit like what's on screen. So what I mean by this is lots of different people and organisations sharing different things in different ways. And the problem is that if you're listening from the outside, it's really hard to hear a sort of clear signal or message through all of this noise, or to draw any kind of consistent understanding about an issue and about our world. But when we draw on the same frames, it can look a bit more like this. So frames are a scaffolding which a whole sector can use to structure their communications, tailoring them to their audiences, dialing different elements up or down, but always fundamentally using the same underpinning ideas. And this isn't about everyone saying the same thing in the same way. We've still got different arrows here that are not quite going in exactly the same direction. But it's about using framing to support the same story and to shift understanding in the same direction to make sure that our messages and the understanding that we're trying to create do actually take hold. Now let's get into the research and what people think about health and obesity. Before we can reframe an issue and tell a new story, we need to understand how people think about it in the first place. Because it has to be the right story, told in the right way, activating and strengthening the ideas that matter, and that will make a difference to how people understand the world around them. This comes down to what we call mindsets. So mindsets, or mental shortcuts, essentially guide our thinking. They are implicit and shared, and they shape our understanding without us realising it. They are default assumptions about the world around us, and they shape how we think and act in the world around issues, around people, and responsibility. They also shape our expectations around how our world should work. They legitimise some actions and scenarios, and they problematise others. And crucially, they are activated by the things that we see and we hear. So the reports that we read, the TV we watch, the podcasts we listen to, the narratives that are all around us that are triggering these different mindsets or deeply held ideas. And framing works when we're able to navigate these mental shortcuts, these mindsets, strengthening the ones that are helpful in achieving positive social change and avoiding the ones that are unproductive. And by activating more productive mindsets more often, we can make them more front of mind, and we can meet people in a much better place to have the right conversation that leads to change. Now, Angela already touched upon these in her introduction, but I think it's worth us looking at them again as well, because it's really important to understand some of the less helpful mindsets that people hold about obesity. And we need to be sort of sidestepping, not triggering in our communications in order to tell a new story. So first of all, people tend to see obesity as the fault of individuals and due to a lack of willpower. And the problem with this perception is that it can lead to blame and a belief that people simply need to eat less and move more, instead of thinking about those more systemic and holistic changes that need to happen to enable people to do that. The focus is very much on individual responsibility, and this leads to stigma and othering. So othering is the sense that this is other people's problem to solve, not something that we all have a stake in. It's sort of arm's length. People also tend to see obesity as an unfortunate and inevitable part of modern life, and therefore insolvable. People get this feeling of sort of fatalism that, you know, we can't really do anything about it because we're up against just this great something that's bigger than ourselves. People do see it as a serious crisis, and people are convinced that this is an issue, but the problem just feels too big. And when people do reach for solutions, they tend to reason that we just need to educate people to make better choices, and that it's ultimately down to the individual, not the systems and contexts that surround us. Now, communications about health and obesity often inadvertently trigger and reinforce these unhelpful mindsets, despite best intentions. And we need to tell a new story which focuses on the wider context beyond individuals and shows how what surrounds us shapes us. In doing so, we can build understanding and support for the wider changes that will enable everyone to thrive and be healthy in Scotland. So now let's get into the useful stuff, the stuff you can apply in your own work. I'm going to talk you through 3 ways to tell a new story. These are outlined in the comms guide, which you'll be able to access after today. So don't feel like you have to be scribbling notes and stuff, but you know, obviously it's up to you however best you learn. Our first recommendation is to lead with health. And if there's one thing that you take away from today, I would say make it this. Think about leading with health first and foremost when you communicate about this issue. I'm going to show you a graph which comes from the research that we did with Guy's and St Thomas's health charity, which is called Impact on Urban Health. And it shows the results of a large-scale experimental survey in which we tested different ways to frame the issue of child obesity. And essentially, these were the sort of 2 frames which, in that clip of the man on the street earlier, we were sort of seeing that difference between whether we framed something in terms of child obesity or in terms of improving their health. So the control group were asked a series of questions about their support for policy change to tackle obesity and their beliefs that society must act on obesity. So they're represented by our thick black line at 0 there along the horizontal axis. Another group read a statement using childhood obesity as the central frame, and then they were asked the same questions. And then a third group were read a statement using improving children's health as the central frame. Then they were asked the same questions again. So here you can see the results. Those red blocks are the results of the people who were read the child obesity frame, and those sort of teal blue coloured blocks are from people who are read that frame around improving children's health. And basically what you see here is that support for policy change was significantly strengthened when people were primed with the idea of improving children's health. And this goes to show how much more powerful our communications can be when we lead with health, not just children's health, but all of our health, adult health as well. And when I say lead, I mean literally mention health first as much as possible, because what we say first impacts on everything that we say afterwards. Once you've triggered a mindset, it's really difficult to walk it back. Triggering an unhelpful mindset like we do when we lead with obesity takes us down the wrong path. But when we lead with health, we start from a place of more helpful mental shortcuts, and people are much more able to hear what we have to say. Making the issue about health was also found to shift the conversation away from a problematic focus on body shape, and this helped to reduce blame and stigma. So a few pointers on what I mean when I say lead with health. In your communications, set the scene with health before mentioning obesity or weight. Making the conversation about more than weight and obesity leads people to focus on the needs that we all have in common instead of homing in on the perceived otherness of people with higher weight. Make the issue about improving health. So what I mean by this is lead with what needs to be improved and created rather than dealt with, the sort of positive results of doing X, Y, Z, rather than we need to do this because look at all these issues. And leading with these positive points of what needs to be improved and created first helps to inspire support for solutions and avoids triggering fatalism, because people can actually see, oh, there is a way we can make this better. Having said this, don't avoid mentioning obesity or weight completely. And when I say obesity or weight, there's more different terminology you could use to describe these as well. Just the most important point here is to not start the conversation with those ideas. You want to be starting your conversation by triggering the idea of health first. Research showed that avoiding that sort of obesity or weight language altogether can have the opposite effect and make people suspicious about our communications. It makes people feel like they're perhaps being manipulated or the real issue is being avoided. So this point is about sequencing and hierarchy rather than sort of blacklisting the idea of obesity and weight altogether in our communications. And it might look something like this. So instead of saying something like the need to tackle Scotland's obesity crisis has prompted heated discussions about what regulations could best tackle the issue, and too often people in Scotland are eating food that is high in fat and sugar, we need to make sure everyone is eating food that is good for them. We could say something like this instead. We need to act now to improve health in Scotland. Too often our schools, workplaces and neighbourhoods are flooded with unhealthy food, and by increasing the flow of healthy options, we can help everyone thrive. So here we're leading with that idea of health first, and also bringing in some of the other recommendations like showing our context, which I'll bring you on to in one moment. Just 1 second, I'm just going to have a wee cough and I'll be back with you. Okay, so our second recommendation is all about showing how what surrounds us shapes us. Let's think back to those fish that I showed you. Our tendency to focus on individuals rather than our context and surroundings. We know that what surrounds someone will shape them, and that the area where a person grows up, whether there's space to run and play, whether there are shops selling healthy food nearby, whether they are experiencing poverty or hardship, will all have a huge impact on their health. But because people don't think about the context when it comes to health and obesity, or it's not as front of mind and they tend to think about individuals, the solution that people tend to think of and are quite limited to is that thought that there's more need for just education. But we know that this alone won't do the job. So we need our communications to surface and to build on this understanding by showing how what surrounds us shapes us. Sorry, bear with me with these tickles that I keep getting. Let's see if we can get through this slide before the next one. So when we're talking about showing how what surrounds us shapes us, this is about connecting opportunities to be healthy with environments where people spend their time. So for example, our high streets, our workplaces, our schools, and how those scenarios shape our health. A really simple change that we can make in our communications is to talk about options and opportunities rather than choices, which can activate a narrow focus on individuals. When we say options or opportunities, we're highlighting what's available to someone, which is a nod to that wider context that surrounds them. But when we say choice, we're back to triggering that mental shortcut that this is just about willpower and individuals making better choices. So again, a really simple thing that we can change, which actually makes quite a significant difference in building that understanding of context and how what surrounds us shapes us. We also have some tested metaphors, which I'm going to talk you through, which can help to make complex concepts much more immediate, and I'll expand on them in a moment. So first, a quick look at how the small change of options instead of choices can have a significant impact. So instead of saying something like this, our delivery plan sets out how we will work with partners in the public and private sector to help people make healthier choices about food. We could say, our delivery plan sets out how we will work with partners in the public and private sector to put healthy food options in reach. So what we're doing here is we're still communicating the same point, but we're shifting the onus from individuals to the organisations and the sort of wider bodies who are responsible for what food options are actually available in the first place. Now, a bit about metaphors, because they can sound a little bit kind of out there, but there's a very good reason why we recommend using them in your communications. Metaphors are really helpful because they can give us new yet familiar ways to think about an issue. So explanatory metaphors can provide a really strong mental image. They can make abstract or complex concepts really simple and concrete and immediate. And they can provide a comparison which helps to build people's understanding in just a really accessible way. And they can also help us to explain why something happens rather than just letting people to reason that it's normal or natural. But of course, not just any old metaphor will do, which is why we go out and test them in our work. And from our work around health and obesity, we found 2 metaphors emerged which were really helpful in building this understanding that what surrounds us shapes us. The first is this metaphor of rivers. So this helps us to explain how the wider food environment shapes our health. And we can use this to explain the roles played by the built environment, the food system, and the commercial practices that surround us by comparing them to an imbalanced system of rivers. So for example, we could describe how our neighbourhoods are flooded with unhealthy food, but there's barely a trickle of healthy options. And when we tested this metaphor, it really helped to increase understanding and to build support for more systemic solutions in a way that was much more sort of immediate and meant we were not having to go into loads and loads of detail, but it was just triggering that really helpful understanding for people. Now, as is the case with all the recommendations today, they're flexible. There's different ways that you can use them. And that's definitely the case when it comes to the 2 metaphors I'm talking to you about today. We can flex it and just use different wording to get the same idea across. So there's lots of examples on screen here, like the relentless tide of unhealthy food advertising, our work canteens even are awash with unhealthy options, and we need to do more to increase the flow of healthy options. And this is not an exhaustive list. There's more ways that you could flex this metaphor, use it in more simple ways, use it in more abstract ways. But my tip would be to avoid triggering fatalism by taking the metaphor too far. So avoid ideas like a tsunami or drowning. Stick instead with this idea of, the river itself, the tide, the flood, the trickle of healthy options is the way to go with it, not sort of painting a kind of disaster movie picture with it. A second metaphor, which tested well for talking about children's health specifically, not so much for adults, but I think it's a helpful one to still be thinking about. And this helps us to talk about the impact of advertising practices on children by comparing it to like putting unhealthy food on a stage. So we can basically use this to talk about how advertising practices are putting unhealthy food in the spotlight, that it's playing a starring role in children's lives, and that healthy food, meanwhile, is being pushed into the wings or pushed off stage. It's not the sort of starring character in the content that children are absorbing. An example of how we could use this in practice, instead of saying something like this, children are spending more time online to study, play and socialise, and we know that children who spend more time online are exposed to more adverts for unhealthy food. We could say increased screen time for learning and playing with friends has set the stage for food companies to put unhealthy products in an even brighter spotlight in our children's minds. So in the first version, we're sort of describing just what's happening, saying children are being exposed to adverts. But in the second, by using the metaphor, we're able to be a bit clearer that this is being done on purpose and also the impact that that's having. So the stage metaphor is really helpful also for explaining how these marketing practices influence children's taste for high sugar, high fat and calorie dense foods. They're helping to show who is responsible, and they're not just leaving people to think that this is just natural and unavoidable, that children will just always like sweet things, and actually looking at things that we could do to make those healthy food be more in the spotlight for young people. Third recommendation I want to share with you today is to use the power of explanation. And this might sound really simple on the surface, but it's really key to getting right in order to build that understanding that we need. How we explain a problem sets up our solutions to it. And by explaining rather than just asserting something to be true, we can ensure that we're building the understanding that we want to. It's like showing our workings rather than just expecting people to get to the same answer as us. Now, we know that people tend to think about obesity as the fault of individuals, and as a result, they're limited to only thinking about individual level solutions, such as education. But by leading people step by step through problems and solutions, we can open up understanding of the need for wider changes to our systems and environment. So what do I mean when I say explanation? Here's an example of the difference between just asserting something and explaining it. If we were just to assert something, we might say the physical and social and commercial environments that we live in have a profound effect on our health. But we could instead explain this, bringing an example, saying something like, when we live surrounded by traffic-filled streets and green spaces nearby are limited, it makes it harder to be active, and this can lead to poorer health. So this first sentence on the left will basically only work if someone already agrees with you. And that's because we're just asserting something to be true without giving any context or explanation. But the second example does much more to explain how our environment impacts on our health. Quite often we think we're explaining something, but we're actually doing that left-hand example where we're just describing it. So it's just about taking a moment to really think about, has there been enough context and examples and explanation for somebody to definitely come to the same conclusion as a result of our communications? There's lots of ways that we can really use the power of explanation. First and foremost, this is about telling a complete story about the factors that shape our health. So part of this is going further than talking about prevalence and instead explaining the factors that shape our health and what can actually be done. People already understand that obesity is an issue, and prevalence figures alone will only make that fatalism worse, rather than building that understanding. So we need to tell a complete story that wraps around things like those figures. Explicitly talk about solutions to emphasise that change is possible, not just necessary, and avoid complex expert terms like the food environment, obesogenic environment, and food insecurity. Instead, bring these concepts to life by explaining them well. What do we mean by those phrases? Where space allows, you can also use something we call step-by-step explanation. So this simply means taking people really explicitly through the sort of connections between causes and outcomes and using language like because, so, and as a result to make these connections. And let's take a look at an example. It's a deceptively simple technique. So when we have space in our copy, this using this step-by-step cause and effect will help us to join the dots. In this example, if we were to just say in parts of Scotland, fast food shops and convenience stores are everywhere, but you have to travel to find shops selling fruit and vegetables. And as a result, it's much harder than it should be for families to eat healthily. The problem with just jumping from that cause to that consequence is based on those sort of mindsets we know that people hold more front of mind when it comes to health and obesity. They might just respond to that by thinking, yep, some neighbourhoods, they have lots of fast food shops, but at the end of the day, anyone can be healthy if they want to be. The solution might be that people just need to learn how to cook better, because you can still make a good meal with tinned vegetables if you want to. We can't rely on people definitely drawing those sort of systemic solutions from this problem that we've illustrated here. But when we're explicit about the links in the chain and join the dots for people, it can point people toward the need for a much more systemic solution. So here we might start with that cause, but then say, this is because there's limited public transport. Travelling to buy food is much harder and more costly. And since healthy food can also be more expensive and take longer to prepare, it's much harder than it should be for families to eat healthily. And of course, a story isn't complete without a solution. So this is where we could say, this is why we need to reduce the cost of healthy food and make sure that healthy options are always available where we live, work and learn. So This isn't always possible. We don't always have space to take people through all these steps. Sometimes it's a case about doing explanation in a much more succinct way, but where we can, doing this kind of step by step in a longer narrative is really helpful to make sure that we're not just assuming people will come to the same conclusion as us. Now, I said that I was going to talk through 3 recommendations today, but I've also got a bonus tip that I wanted to share, and there are more of these in the communications guide that we've created with Public Health Scotland, so do look at those too. Today, I just wanted to focus on this one, which is to use numbers to strengthen your story, not to tell it. Numbers and data can be a really meaningful addition to our communications, but people often make the mistake of thinking that they can just speak for themselves. The problem with this is that if we don't frame our numbers, this tends to happen. And what I mean by this is that they'll be interpreted in different ways according to the mindsets which are most prominent for people. So numbers need to be framed too, or we risk triggering the mindsets we're hoping to avoid or telling the wrong story entirely. Be particularly careful with prevalent stats such as this one: 2 in 3 adults are overweight and obese, because without any story or context around these stats, we can trigger unhelpful mindsets such as fatalism, feeling that this is a huge issue. People tend to then default to the individual blame, like why are all these people being obese? And individual solutions. So when people are then sort of reaching for how we would tackle this problem, they're still reaching for that sort of front of mind thought about people just need to eat less and move more, or we just need to educate them to do so. And as we said earlier, when I was saying it's really important to lead with health, because what we see first really affects what we see afterwards. Once we trigger these less helpful mindsets, it's really hard to walk them back. So even if we go on to add context after the fact, leading with them can be counterproductive, and we need to be careful about that. Our research showed us that people already know obesity is a problem, so this isn't the priority story we need to be telling, or at least it's not the whole story. So what I'm saying here is basically don't expect numbers to do the heavy lifting, put them in context, and also consider whether they are actually supporting your story in the first place. Another quick example before we round up today. Without context, this stat on the left once again risks fueling individual blame. So by just saying Scots eat 3 times more sugar than recommended, people will default to thinking, well, they need to eat less sugar. There's nothing there that's leading us to think around the context that explains why this is the case, such as sugar-laden foods being cheaper and more accessible, and some seemingly healthy foods like yogurts and pasta sauces actually often being high in sugar. So instead, we could think about being a bit more creative with our stats, like the one on the right. This stat on the right bakes in context, pardon the pun, given that it's pizza, but this is basically showing how portion sizes have increased significantly over the years. And what this stat is doing is that it's actually starting with the story that we want to tell, the fact that what surrounds us shapes us and our health. To recap, the 3 principles that I've chatted you through today and the bonus tip to take away is to lead with health, show how what surrounds us shapes us, and to use the power of explanation and using our numbers to strengthen our story, but not relying on them to tell the whole story. And if you take away just one thing today, I would say really think about leading with health. And then I think a lot of the rest of this can follow if we're really keeping that in mind. Before we go to the Q&A, just a quick reminder of why we're here. It's to move from this, lots of us saying different things in different ways, to this. All of our communications still having variation and variety between them, but moving in that same direction to make sure that our messages and the understanding that we're trying to create do actually take hold. Thank you very much, and I will stop sharing my screen now because I'm really looking forward to answering any questions that you might have.
That's great, Sophie. Thank you so much for the great presentation and the introduction to framing and our newly published guidance document. Link we'll be sharing with you shortly. For those of you who don't know me, I'm Suze Connolly, and I've been working closely with Sophie around this work. In the time that we've left, we are going to do our best to address some of the questions coming in. Just a reminder that there's a Q&A function on your screen. And you can make a contribution there. I'll also be facilitating the questions, and I won't be calling on you to come on screen just in case anyone is fearing that will be the case. So first off, Sophie, I guess one for me, I hear a lot about in our work about the need to use more impactful language, like highlighting risks and harms associated with having higher weight. The approach being advocated by Frameworks UK and the research you've done suggests that we should be moving away from that. And I just wondered if you could say a bit more about that.
Yeah, of course. And this is a question that we get asked quite a lot when it comes to this work. Basically, this comes back to thinking of those sort of mindsets I was talking about, those understandings that are more front of mind to people. So the issue with, if we're to lead with just a harsher language and risks and kind of almost trying to scare people straight, scare them healthy, the problem is, from everything that we know about how people understand this issue, it's not really triggering very helpful understandings for people of actually what needs to be done. It's already really front of mind for people that this is a big issue. People have concerns about things like the impacts on the NHS, and people have concerns about their own health as well. They don't need to be scared more or told off in order to be able to be healthier. What they actually need is support from wider systemic solutions. So our communications need to reflect that as well. And a lot of this is about sort of rebalancing the conversation. We're not saying that there's nothing to do with sort of individual action when it comes to our health, but the fact is that individuals can only be so healthy as their circumstances are allowing them to be. So our communications basically need to reflect that, and our concerns about just sort of leading with that sort of scarier language or risk language is that it's really just telling the same story that's been told again and again, and we've seen as not really actually making the difference we need it to.
Great, thanks very much. I can see the questions are starting to come in. I think my offer of facilitating them rather than putting people on screen probably helped a bit. So have you used any evidence-based social or behavioural change models or frameworks around your research or strategic communication planning? Okay, so hopefully I'm understanding this question properly, but basically all of our work at Frameworks is evidence-based. So we carry out our own research, which is looking, within the context of, so for example, we're looking to improve health in the UK. Our research is using thousands of people from across the UK, using representative samples in order to understand how do people understand social issues. And then we test these different frames to see how can we shift that understanding in helpful ways, how can we build support for policies in helpful ways. And this is different from behaviour change, which you might have heard referred to as sometimes nudge theory, where it's more looking at sort of in the moment, how can we prompt people to behave differently, make different choices and stuff. I think there's still a place for that within any sort of communication strategy, but what we do at Frameworks is a bit different, where we're actually going that sort of level deeper to how are people understanding this, and therefore how do we need to communicate in order to shift that understanding so we're actually starting in a much better place for that conversation, where then other things like behaviour change tactics might also be more effective because we're meeting people in the right place in the first place to be having that more kind of productive understanding and conversation. Great, thanks, Sophie. Hopefully that's unpicked that a little bit further. Just a question that I have myself actually is this for everyone? Like, do you look at messaging or segmenting it by different audiences? Yeah.
So I guess that's one of the things that makes our work at Frameworks a bit different. Often when it comes to communication strategies, people are looking at those segments, looking at those sort of priority audiences. Whereas at Frameworks, our research is looking at how can we kind of shift the whole house, how can we get everybody on the same page and on a helpful page. Having said that, within that sort of overarching framing strategy, there will always be ways that we can then really sort of maximise different communications if you know that you're speaking to a specific audience. And that's where I'd say you can absolutely kind of overlay audience insights on top of framing. And my advice would be that you could use these sort of framing recommendations as that kind of overarching bridge that's across all of your communications for everybody. And then thinking about how you can flex that even more specifically for particular audiences. So some audiences, such as policymakers, might say, show me the numbers. And in that case, we'd say, OK, let's show them the numbers, but making sure that we're still framing those numbers well within the context of health. For other people, the most important thing might be, you know, what can you do to help me? And so it's telling, this is how we can help you to improve your health, for example. So the two don't contradict, it's just that we can't sort of throw that overarching framing out the window when we're looking at those individual audiences as well. And a lot of our work at Frameworks is not just about doing the research, it's about working with communicators, with organisations to see how can they flex the framing in that way so they're still staying true to those insights, but also maximising them where they might have that more kind of specific communications aim.
Great, thank you. So the questions are coming in now, fast and thick. So someone has said a really great approach, but in the example where the suggested solution is improving the transport systems to access healthier foods, how does this empower the individual in the here and now?
So that's a really fair point, and I think this comes down to there's more than one solution to this. There's more than one solution. I've pulled out, that was one example in there of how we could apply this when we're putting that sort of need for improved transport within that context, you know, being one of those wider determinants on our health. There are other solutions that we need that will also help people in the here and now. And likewise, we can use these same communications principles for talking about those. It's true, that example of improving transport is going to take time and it's going to take investment. It doesn't mean that we shouldn't be talking about it though, and it should still be playing a part in our sort of wider narrative across the sector. But yeah, we need to be sharing more than one solution to this issue, because it is a wide-ranging issue with many different ways that we can improve things for people, both short-term and long-term.
Great, thank you. And the next question is actually about the media, and I know that you and I have talked about this a bit, is that it's all well and good, I guess, public health or other stakeholders engaging in framing, but that the media often reframe the story or are only interested in an alarming story. And do you have any suggestions for how we might deal with that? Yeah, it'd be really good to hear your thoughts on that.
Yeah, and this is a question that comes up for us a lot across different issues, and I'm not going to pretend that this isn't a tricky aspect of sort of narrative change. It can be really hard, and particularly the way that our media is structured, it tends to sort of go for what's that headline grabbing approach. There are ways though that we can sort of ameliorate the situation. So first of all, by making sure that the spokespeople in your organisation really have that understanding of framing. So as much as possible, if they're actually in a sort of interview or conversation situation, they can help to sort of move the conversation in the direction it needs to be going in. Second of all, really sort of thinking about, often when it comes to sort of media attention, we're going to them or they're coming to us for a particular story. So thinking, how can we make stories around context and around that health attractive for media? So thinking of it still in the other ways that you would do for being a sort of media grabbing story, what's novel about it, what's timely. We can still tell stories like that when it comes to these communications principles, to sort of move away from just that same sort of alarmist story which tends to come up. And my third thing I would say, within something like a press release even, we can be a bit tactical. So we have seen across other social issues that often in press releases, if we include one of our tested metaphors, they go down really well with the media, because actually in the same way that that's a really succinct way of summing up a problem or a solution to a problem, it therefore works really well in a headline which has to be short. So if you were trying to get media attention for the fact that our high streets are flooded with unhealthy food options, I think that could be, we've seen that being quite an attractive angle for the media. So it's thinking about still, basically, part of what we're saying here is it's not that we shouldn't be talking about the problem at all, but reframing the problem. So instead of it being the fault of individuals, it's looking at our surroundings. That's still a very gripping and engaging story for the media, but just thinking about that strategic thought first of, instead of maybe starting with, well, this is what we usually say, how do we reframe it? Maybe also thinking, maybe we say something different this time, that's starting from that standpoint of what these ideas are that we need to get across.
Yeah, I can see from the the chat that there's quite a bit of interest in and around media, and There's some other questions about, well, which you've partially answered, about how this thinking is received by the media. And do you think the journalists are increasingly understanding the impact of how they frame stories, frame news stories? I don't know if you want to offer any further comment on that, Sophie.
Yeah, so I would say, often we have a bit of a sense of, depending on different media outlets, how receptive they might be to our stories in the first place. And for media outlets who maybe are looking at those more progressive solutions themselves, they might well sort of more happily and easily adopt these frames. For other outlets where that's maybe not so much their priority, I would say the way that we can get this story through, it kind of comes back to that slide with all the arrows on it, where if everybody across the sector is all pushing the same story, it becomes quite difficult for media outlets to still say, no, we want to tell the old story we were telling, because all of the people who are the experts in this area are saying, this is about this, you need to get with the programme, this is the story. So it's partly also just about that overwhelming sort of, even if you're a small organisation, if others around you are all sort of drawing from the same frames and using, still putting your own stamp on it, that's a really empowering way to help to shift the story in the media as well.
Great, thank you. A question about food industry marketing, marketing their products, and the press to provide impact often use language that puts the onus on the individual. And how can we compete with this or address this?
Yeah, so I think this kind of comes down to that kind of age-old problem of counter-narratives, and something that I would say, we've spoken today about what is the story that we want to tell. There's a particular additional tip that's in our comms guide that I would urge people to take a look at, which is this idea of not myth-busting, avoiding myth-busting. So it might be really tempting in the face of that narrative of sort of saying, this is about individuals choosing these products. Our counter-narrative shouldn't be, oh no, it's not about the individual, this is what it's about. Just start with what this is about and say, well, in an environment where people are entering a supermarket and there's buy one get one free on all of these items which are unhealthy, and meanwhile filling up a trolley with healthy food options is going to be much more expensive at a time where costs are high. This is the issue. It's about context. It's about what options are available to people. And that's helping to shift this away from choices to options, but in a way that's not just sort of saying, no, it's not that, it's this. Just lead with, it is this. It's this story of context and what is available to people. And any individual is operating within a wider context. So it's building that understanding first.
Great, thank you. A question about the metaphors and the timeline of their usefulness. This person is saying, surely there's only so long talking about a flood before we have to move on to framing it differently.
Yeah, so this is the interesting thing about metaphors, is that I'd say they're not useful because of their novelty. They're useful because of that understanding that they're building. So actually, if over time we're using it again and in different ways, so talking about a flood, talking about you being overwhelmed, talking about a tide, talking about a trickle of healthy food and using it in different ways, actually, if we get to the point where that is then really front of mind and people are sort of repeating it and it's almost feeling a bit old hat for people who are in this space talking about this, I'd say when it starts to feel a bit kind of like, oh, we've used this a bit already, that's the point where you're really starting to cut through, because most people who are not thinking about health communications first and foremost in their day-to-day life, you've probably only just started to reach them at the point where you're starting to get bored of a metaphor. And yeah, so it comes, as I'm saying, don't worry about using metaphors as their reason is not that it's kind of this new idea. It's the reason that they're useful and they've shown to be useful in our testing is because they're immediate, they build an understanding we need to build. I would say that we shouldn't just rely on metaphors as being the only hook for our story, and we should also be thinking about other ways that we can engage people in an issue. But going back to those other principles as well, as with any communications, think about different ways that you can make the same point and the same idea to sort of keep things fresh. But I would say don't feel that, oh, there's an expiry date for these metaphors, because actually every day, I can't remember the exact fact, but I think something like every 10 minutes or something, we naturally use a metaphor in the way that we speak, and there's a lot of phrases that we use that we don't necessarily think of as metaphors, but technically they are. And I would say if we got to the point where some of these metaphors were so embedded in the way that we talked and thought, then I would say that would be an absolute win, and I wouldn't be at all worried about them becoming tired.
That's great. And I suppose also this is, you're doing lots of work in and around this, and new learning will be evolving as we go on. So this isn't just you know, we're saying this is how it is forever. The research and learning will be evolving as we go on. So just a question about evaluation. And something that we talk a lot about in public health is about how we know that work is making a difference. And I'm just wondering if you could talk a little bit to that.
Absolutely. So I think this kind of chimes with a question that we get asked a lot about narrative change and using framing in order to do that, which is that it's both a short-term tactic and a long-term strategy. So what I mean by that is, all of our research tells us that if we are triggering these more helpful mindsets and avoiding triggering the less productive ones, day to day in our conversations and in our asks, we're more likely to be getting the results that we want because we're meeting people in a more helpful place. The other side of that is that long-term narrative change, which is, you know, the more that people see and hear these helpful sort of mindsets triggered in our communications, the more that we sort of build that deeper understanding over time, and the more that those more helpful mindsets are more front of mind for people. And I think that's the bit which can be harder to evaluate because it takes time and it takes consistency and it takes more than one organisation in order to change a narrative. Now, excitingly, like as you saw in my introduction, we work in a lot of different issue areas, sort of across different sectors. And one of our projects where we've been working for a bit longer and been able to start to see some of that more kind of that deeper change over time is in our Talking About Poverty work with Joseph Rowntree Foundation. And they've actually recently carried out an evaluation to sort of see, you know, over the last few years, what kind of shift has there been in that sort of wider narrative. And it's available online if you search for it, or I can pop the link in the chat as well for us to share. Some really sort of positive findings about how actually where a lot of organisations working in the same space have been mobilising the same frames. We've seen this sort of helpful sort of shifts in understandings, and that leading to some quite interesting things happening in the policy space. So for example, not too long ago, we actually saw a very surprising thing happening in Westminster, where a whole bunch of backbench Tory MPs basically rebelled and said, no, don't get rid of the uplift to universal credit. And now this is something which we can't necessarily definitely point to the poverty reframing work as saying this is what led to that, but I think it's too much of a coincidence for that to be a correlation and not some kind of causation of there being this consistent narrative about poverty not being people's faults, people needing this lifeline of support from universal credit, which is actually fed through even to that audience we would not expect to be rebelling that way. So definitely take a look at that evaluation, and it is something which it takes time and it takes many voices to really change a narrative.
I see that a question related to that has come in about how we're planning on tracking and measuring the impact of this work on public perceptions and environments. And I just don't know if you want to say a wee bit more about that, Sophie.
Yeah, so as part of this work with Public Health Scotland, we are doing what we call a kind of baseline evaluation. So at this point, sort of before these frames have necessarily been picked up hugely by the sector, we're looking at what do current communications look like and what are the sort of most front of mind ideas that are being triggered. And then we hope then we have that sort of baseline look at how does communications look. And then at a future point, we can always do another evaluation, which is saying like, let's look at this shift of what communications are now looking like. And now, obviously, that evaluation is looking at sort of outputs rather than the shifts within individual people's sort of perceptions of an issue. But I think it's an excellent place to start. And we are always, as an organisation, looking at other ways to evaluate our work and the nature of it is that we have to be quite holistic. So we have to also look at what's happening in the policy space. Where are we seeing some of the specific wording being picked up, maybe in a speech from somebody really key in the sector, or even from people who you might not necessarily think we'd be picking up on the framing.
Great, thanks, Sophie. There's a suggestion or a comment here about, can framework go into universities to present to health workers, health visiting, for example, as the positive framework needs to start in the home environment, as well as looking at what's around us in our schools and communities. And there's similar questions around doctors and midwives and how they currently lead with risk. So is that something you want to?
So I guess my answer to that would be that framing is for everyone. You don't necessarily have to be somebody who has communications in their job title or thinks of themselves as a communicator in order to pick up and start using these frames. In terms of, can we go into university and present this to people? I mean, we'd love to. Please get in touch if you'd like to work with us in that way. But also, as much as possible, I mean, this is why that we like to make all of our resources public, because we don't want it to only be that you have to come to us in order to use this stuff. We have, things like the comms guide we've created that's launching today, is trying to make this as practical as possible, including examples, so that we hope that anybody could take it and start applying it. And all of our work with other partners in overlapping spaces is freely available through our own website. So it is a resource that is there for everybody. And that's why we are ourselves a mission-driven organisation. We are not-for-profit, and we would love for as many people as possible to be using this framing in their work.
That's great. Thanks, Sophie. We're also doing some work at Public Health Scotland to upskill individuals to be able to go into other organisations or take the learning back into their organisations and provide some training. So that might also be helpful in addressing some of those comments. There's a question here about health literacy approaches and whether they were considered within the research and how to frame the conversation.
So you might have to help me with that one a little bit, Suze. When we say health literacy, do we mean people's understanding of their own health and the factors that shape it, or it might just be a terminology I'm not so familiar with?
Yes, I think that would be a good, fair assumption.
Yeah, so I would say that this kind of comes back to kind of needing to explain things. So not assuming that if there's specialist language around health and improving health that people will necessarily understand it. But I would say also that this sounds a little bit like it's straying into, do people understand how to keep themselves healthy? And I would say that the aim of this work is to do something a bit broader than that. There's always going to still be a space for that, but actually what we've really seen we need to do with a kind of shift in narrative is looking at not just focusing on those individual approaches to people improving their own health, because the sort of side effect of that is we see quite a lot of blame and stigma, which means that people are not so much in support for those broader systemic changes. So there's a place for both, but I would say that if what you mean is those kind of, do people understand their own health, that's definitely an important thing to consider, but it wasn't the sort of key aim of our research here. But on that point of, if your point is more to do with people's own understanding of what we're talking about, this is where I'd always say, use plain English. Don't assume that people come to the same conclusion as you. Do take people through things step by step and actually consciously explain as much as you can instead of sort of assuming knowledge.
Thanks. There are still quite a number of questions coming in, and I appreciate that we've not gotten to all of those today, but I'm just going to wrap up with one that's come in about someone saying they found the session extremely useful, and they'd agree with the point about many voices being required to change the narrative. And do you feel like it's best for this to be facilitated at a very local level or at a national level?
So this, within our work at Frameworks, we're always interested to look at, what are the ways that we can get these frames out there to as many people as possible. Our approach tends to be sort of looking at what are the big organisations working in a space, because people tend to look to them or collaborate with them, and that's one way that we can actually reach a lot of different people by working with a big body like yourselves at Public Health Scotland. And we've done the same in other areas. For example, of the poverty work, Joseph Brown Foundation acted as a kind of organising voice, but lots of other grassroots and other sides of organisations got on board with that reframing of the narrative. Having said that, there's other instances where we can sometimes look to test our work in a local space and then almost kind of scale it up from that. Our approach tends to be, we start at that sort of bigger level, a like-minded organisation who can then mobilise others to run with the same narrative. But at the end of the day, any way that we can get to lots of people singing from the same song sheet is desirable, and we're always open to trying new ways.
Great, Sophie, thanks very much for that. And I'd be in agreement with that. And we are, as I said, doing some bespoke training with the organisations who work very closely with local communities to try and really embed this approach. So I'm going to move to draw the session to a close. A huge thanks in particular to our speakers today, Public Health Scotland's Chief Exec Angela Leach, and to Sophie, of course, from Frameworks UK. I wanted also to give a quick shout out to Impact on Urban Health, who've been one of the leading lights around the drive to reframe how we communicate and engage the public about obesity, and who have very generously granted permission to use many of the images you've seen dotted around the presentation in our guidance document and social media. And of course, I think there's about 450 of you that signed up today. Some of you joined us live, but also will be reviewing the recording. So hopefully this is just the beginning of our conversation. Before you head off, we'd be really grateful if you could take a few moments to complete a short evaluation. A link to this would hopefully miraculously be appearing in the chat as we speak. This helps us to plan our events and to inform any future directions we may wish to take about this work. If we didn't get to your questions today, and I appreciate that I did not, or if you have any further comments you'd like to make,
because that was meant to be Michael's job.
We'll also be sharing a link to something called a Padlet, where you can post any follow-up questions, make comments and engage in further chat around this topic. We'll be responding to those questions, and the Padlet will remain open for the next week or so. As a reminder, today's session has been recorded, and you'll find a link winging its way to your inbox very soon. And we'll be adding a link to this recording, which will sit alongside the guidance document on the Public Health Scotland website. Hopefully, this will continue to serve as a useful introduction to framing for folks new to this or who were unable to attend today. Finally, as Angela mentioned, today's event and the publication builds upon our work on weight stigma and is another step along our journey to changing perspectives on how we talk about health and obesity, to challenge those misconceptions and to actively and meaningfully work towards ending stigma. So I just want to say thanks again for joining us today, and I hope you have an enjoyable rest of your day. Thanks again.